You talked about the European experience in RES testing and quality assessment. Are there many different RES testing methods, and what about the sensitivity?
Yes. Well, there are quite a lot of RES testing, and they are increasing all the time. So the original testing was often done with a classic Sanger sequencing. That was in the process of being replaced by more commercial tests, and there's a huge variety of that. But what we see now happening is that we see a change into next generation sequencing methods, and that's a whole new way of testing, and those are methods that are being developed by different laboratories in consortia. And it's very important to select the right test, because some tests are more sensitive than others. And of course, if you do a test, you have to know the sensitivity, and you have to know what the cutoff level is going to be for your test. And for RES testing, what we see now, the accepted cutoff level is that more than 5% of the cells need to have a mutation before you can call it mutated.
Can you tell something about the OncoNetwork Consortium and the importance of quality assessment?
Yeah, so when we started doing these tests, which originally were Sanger sequencing, which is not a very difficult test, we realized after our first quality assessment that still 10 to 15% of the laboratories made mistakes. So therefore we have now in Europe the quality assessment programs in the different countries, and we find always that the first time laboratories participate with a test or with a new test, they make 10 to 15% make a mistake, and we can give feedback so that it improves. So that's what the European Quality Assessment Program does. The OncoNetwork was a group of laboratories that adopted the next generation sequencing and realized that you need to test hundreds of samples, at least in 2 to 3 different laboratories, and get the same result before you can accept a test as robust and validated. And that has been done, so now everybody that uses that technology can use that approach.
And what about the ASP Quality Assurance Program?
Yeah, so the Quality Assurance Program now runs since 2008. So, well, the first was in 2009, so 5 years. And there we have more than 25 countries, laboratories participating, and a couple of hundred laboratories in total. So it's quite successful, and what I find the most important thing is that we can see that laboratories that participate improve their quality. And so in all the countries there are laboratories that have excellent quality now, but also in all the countries there are laboratories that make mistakes. So we feel it's very important that we keep running this program, and we also publish the data on our website so that one can see which are good labs. We don't publish the labs that do not well, but if you know that the lab is good, that's the most important.
And can you tell something about the relevance today of the pre-analytical phase?
Well, it's a very important point. So far, pathologists looked for the pre-analytical phase, so how tissue was collected, fixed, processed, with the end result, the morphology, the slide they see through the microscope. Nowadays we need to do immunohistochemistry, we do DNA tests, RNA tests, so other things are also important. And we now have learned that proper fixation is extremely important for DNA quality. So the control and the standardization of the pre-analytical phase is way more important than it used to be. So pathologists have to take action on that to have that in a very good way.
And what about testing RES mutants in circulating DNA?
Well, that's a very interesting and important development. So several papers have shown that it's feasible. And now we are waiting for big studies in many patients on the reliability of it, and the moment and the way to do it. And so everybody thinks it's going to be very important, but everybody knows that still lots has to be done before we can use it in a routine practice.
And why is it important for oncologists to know what their pathologists are testing and how?
Well, what we have seen the last year is a change in colorectal cancer testing for EGFR targeted treatment from KRAS exon 2 to a complete RES testing, which includes more exons to be tested. Now this is new information and that has to be taken up by pathologists. Not all pathologists go to oncology meetings, so communication is important. People have to learn about this, have to make choices. And then it's very important that oncologists know what choices the pathologists need to make, so the communication is important. And we expect actually new genes that have to be tested in the near future. So it's very important that there is a good communication between pathologists and oncologists on what needs to be tested.